Good day po. My name is Angelo Dagdagan from BSN 31 in Wesleyan University, Philippines. And today I'm going to perform all about the NGTP. So for the purpose po is to provide adequate nourishment to patients who cannot feed themselves. Second one is to administer medication. And third is to provide nourishment to patients who cannot be fed through mouth, like yung surgery in oral cavity, unconscious patient, or in comatose test. So, for the equipment po, so we need to prepare po yung prescribed feeding formula po. Then, stethoscope, non-sterile gloves po, alcohol preps, PPE, then water irrigation po, for irrigation, then emesis basin, tape measure, then towel po, and then pH paper. So for the assessment po, so i-assess po natin yung abdomen niya by inspecting the presence of distension, auscultate po natin yung bowel sounds, and papalpate po natin yung abdomen for firmness or tenderness. Then, assess po natin yung patient or yung family understanding po for their level of consciousness and also the level of understanding. So, i-address natin yung mga concerns o yung mga questions nila by expressing yung mga nursing intervention na gagawin natin during the procedure. So, number one na unang gagawin natin is yung assemble yung equipment po. Yung check po natin yung medical order po natin. For the amount, concentration po, type and frequency of tube feeding on patient's chart. Then, check po natin yung expiration date po of the formula. Then, second one po is magpe-perform po tayo ng hand hygiene. And observe po yung infection control procedure. And then, magsusud tayo ng PPE to protect ourselves and to prevent the spread of the microorganism. Then, after po na maisod natin yung PPE natin, is identify natin yung patient po natin. Hello po, my name is Angelo Dagdagan from Wesleyan University, Philippines po, and I am your nurse for today, ma'am. Ma'am, may I know your name po?
Kate.
So, your Kate po. So, after identifying the patient po, explain po natin sa kanya yung procedure, why is it necessary, and how or she can coordinate with the procedure. So, ma'am, ang gagawin po natin ngayon is all about the NGT feeding po. So yung purpose po nito is to administer yung medication po and to provide po yung appropriate nutrients po ng kailangan ng katawan niyo po. So okay lang po ba ma'am? Proceed na po tayo. Okay. Then after po nun, so assemble po natin yung mga equipment na gagamitin natin above the bed table within reach. So ayan po. Then after po nun, so magpo-provide tayo ng privacy sa may patient natin. Ko-close natin yung door and also the curtain. Then raise natin yung bed to a comfortable height. Working position, usually yung elbow height of the caregiver. Then, perform tayo ng key abdominal assessment using yung papalpate natin yung sa may abdomen ng patient natin, i-auscultate, and etc. Then, next po nun is position po natin yung patient natin. Especially yung head po nila bed are elevated at least po 30 to 45 degrees of near normal position for eating as possible. So, position po yun. So, it is usually po yung semi-powerless position or high powerless position. Then, after po nun, so magpuput up po tayo ng gloves. Then, after po nun, so unpin po natin yung tube from the patient's gown po. So, assuming na naalis na po, then verify po natin yung position of the marking on the tube of the nostril and measure po natin yung length of exposed tube po using the measure tape po. Then, compare po natin siya sa mga sa NG tube na naka-insert po sa may nose ng ating patient. Then, after po nun, so mag-attach po tayo ng syringe to the end of the tube and aspirate a small amount of stomach contents. After po nun po, so lalagay po natin siya sa pH paper po. And compare po yung color according to the charting manufacturer. So visualize po natin yung aspirated contents po, checking for their consistency and the color. Then, if it is not possible to aspirate po contents, yung assessment to check placement po of the inconclusive, so the exposed tube po, length has changed, so if there any other indication po, so we may use po yung x-ray po, so to identify po kung nasan po yung position ng NGT natin. Then, after multiple steps have been taken to ensure that the feeding tube is located in the stomach or small intestine, so aspirate tayo ng all gastric contents with the syringe and measure to check for the residual amount of feeding in the stomach. Aspirate tayo. Ilalagay po natin for example dito po to check po yung residual amount. Then, return natin yung residual amount po ulit dun sa may end tube. As indicated by the medical record. Then, next po is magpa-flush tube tayo with 30 ml water per irrigation. Then, di-disconnect po natin yung syringe from tubing and cup and tubing while preparing the formula feeding equipment. Po natin, magpa-flush po tayo using the irrigation water po. Aspirate tayo ng 30 ml. Then, insert po natin siya. Flush it. Then, after po nun is magre-remove tayo ng gloves natin. Then, assuming po na na-remove po natin yung gloves natin, magpuput up po tayo ng gloves ulit before preparing po dun sa may feeding formula na gagawin natin. Then, next po, when using a large syringe po, remove plunger from 30 to 60 ml syringe po. Then, attach po natin yung syringe to feeding tube. Then, pour po tayo ng pre-measured amount of tube feeding po, formula into syringe. Yan po. Then, open po natin yung clamp and allow po food to enter tube. Then, after po nun, so i-regulate po natin yung rate, fast or slow by height of the syringe. So, para mas madali mapunta yung formula feeding into the stomach po. Then after po nun, so we must not push the formula with syringe plunger. Then after po nun, so add 30 to 60 ml po or 1 to 2 ounces of water for irrigation to syringe when feeding is almost completed, and allow it to run through the tube. So it helps po for the better passage po nun sa nutrients na i-administer natin sa may patient natin. Then after po nun, so when syringe has emptied, hold natin yung syringe high and disconnect from the tube. Then, ikaklamp po natin siya. Then, ikakap po natin siya. Then, observe po. Then, after po nun, observe po natin yung patient response during and after the tube feeding, and assess po natin yung abdomen at least once a shift. Then, have the patient remain in upright position for at least 1 hour after feeding. So, mananatili po kayo ng para po mas mabilis, mas appropriate or accurate po yung pagpunta po ng nutrients po natin sa stomach niyo po. Then, after po nun, so re-remove po natin yung mga equipment na nagamit natin and return the patient to a position of comfort. So, ayan po, for example po, na-comfortable yung patient natin. Pero upright position pa rin po kasi sabi nga po natin kanina, kailangan po siyang manatili na 1 hour na nakaganon po. Then, after po nun, so re-remove po natin yung gloves natin. So, assuming na na-remove po yung gloves ko po, then na-raise po natin yung side rail po to provide safety for the patient. Then, after po nun, so magpuput po ulit tayo ng gloves. Then, wash it and clean po yung mga equipment na nagamit natin or replace. That is according to the agency policy. And then, after po nun, so magre-remove na tayo ng gloves. Then, discard po natin. Then, remove po natin yung additional PPE natin. Go po. If used. Then, after po nun, is magpe-perform tayo ng hand hygiene. And then, document natin yung procedure na nagawa natin. And that's all po for NGT PD. Thank you.